Hello, my name is Kylie, and I'm going to be presenting some examples of directional terms, the 9 abdominopelvic regions, and then abdominopelvic quadrants, as well as the body planes on a model. Thankfully, my boyfriend has graciously volunteered to be my model for. The term interior, or also ventral, means towards the front. The palms are on the interior side of the body. The posterior or dorsal means towards the back. The spinal cord is posterior to the esophagus. The term superior or cranial means towards the head, so the nose would be superior to the mouth. The term inferior or caudal means towards the tail. The feet would be inferior to the knees. So proximal means closer to the point of origin, which generally is the trunk. So the knee is proximal to the ankle. So distal means farther away from the point of origin, which is generally the trunk. So the wrist would be distal to the elbow. So medial means closer to the midline of the body or a body part on the inward side. The ear is medial to the shoulder. Lateral means farther away from the midline of the body or a body part on the outer side. So the thumb is lateral to the index finger. So superficial means closer to the surface. So the skin is superficial to the muscle. The term deep means further below the surface. So bone is deep to the skin. Next, I will be discussing body planes. The first body plane is the sagittal plane. The sagittal plane divides the body into right and left sections. The next plane is the frontal plane or the coronal plane, which divides the body or body parts into interior and posterior sections. The last body plane is the transverse plane or the horizontal plane, which divides the body or body parts into superior and inferior parts. Next, I will be discussing the abdominopelvic quadrants. The first quadrant is the right upper quadrant or the RUQ. The next quadrant is the left upper quadrant or the LUQ. The third quadrant is the right lower quadrant, or the RLQ. And the final quadrant is the left lower quadrant, or the LLQ. Finally, I will show the 9 abdominopelvic regions, beginning with the right hypochondriac region, the epigastric region, the left hypochondriac region, the right lumbar region, the umbilical region, the left lumbar region, the right iliac region, the hypogastric region, and the left iliac region. Thank you for watching.